introduction. I met Lenny at the awesome Napa Experience Dental CE Extraordinaire course, and we went out there. Nope, it's still doing an echo. We're both echoing. Shoot.
Sounds good here.
So Jim, you're not hearing anything?
No, it sounds good here. I'm not hearing any echo. So you just did that. So it sounds good.
And I'm not hearing an echo either.
I'll try and get some AirPods on. Let's try that. I'll be right back.
Okay. So Jim, you look familiar. I think we met before, Jim?
Yeah, Leonard, I can't remember exactly where, but we have run into each other, different dental watering holes, I'm sure. Yeah. I was one of Dawson's students back in the 80s. I started with Peter, and did you go to his service? Were you at his service?
Yes. I was at both of them.
Yeah,
maybe that's where I saw you.
At the one at the church, yeah.
Okay.
That might have been in St. Petersburg. That might have been the last time. Yeah. But yeah, we've run across each other before.
Is that better now?
Kevin, are you back?
I'm back.
Sounds good.
I'm not hearing any echo now. All right. Dino said no echo. I think we should be okay. All right. Round 3, I guess. We'll try this out again. So I'll share my experience. I met Lenny. He put on an awesome experience of a dental CE out in Napa, and he did it 2 years ago. Looking forward to the one in October of this year, but it's something that I've found tremendous enjoyment out of the Napa experience, but also just an awesome dental education as well. So you did a presentation, and then we kind of started meeting up and talking through, and you invited me to the Dawson Academy, and it changed my life. And it was something that it changed my practice. It changed how I do things, and it's something that we've really formed a friendship and a mentorship even after I've been done with this. And I would love for you to just kind of share just your experiences as you went as a young student through the Dawson Academy, but also just, even your dental school days, because we do have some dental students. So I guess we can kind of pick it up from there.
Well, yeah. So, one of the things that really kind of helped catapult me out of the gates when I graduated. So I went to Northwestern University back when they actually had a dental school. And the dental school was at the medical campuses downtown Chicago. And so the building that I lived in was actually right next door to the headquarters of the ADA building. And so, if you're a younger dentist, you may not realize it, but all the major organizations in dentistry are headquartered in Chicago. And of course, the midwinter meeting every year is one of the bigger dental meetings in the world, and it still is. And even back then, in the mid to late 1990s, when I was in dental schoal, it was 4 days of CE. So I was going to all this CE every year for free there. And then the ADA, they had a nice lecture facility in the headquarters there, and it seemed like every 2 or 3 times a month they were having a speaker into the ADA as well. So I got exposure to a tremendous amount of education while I was a dental student. And the interesting thing about that experience was everything that I was learning in these CE courses had nothing to do with anything that I was being taught in dental school. Sure. Nothing was being done the same way. And so what I realized was, goodness gracious, I'm going to have to get out of school, and I need to immediately start taking CE courses if I want to be able to do the dentistry that I was seeing in all these presentations at the Midwinter and the ADA, and all these amazing speakers that really inspired me as well, because I looked at these great dentists and I thought, wow, if I really want to be something in my career, I need to aspire to be something like this. So I looked at these people and I thought, well, they're triple threats, because in Hollywood, a triple threat is somebody who can sing, they can dance, and they can act. Well, if you're like a triple threat in dentistry, you can do the dentistry, you can write about it and publish it, you can document it, and then you can talk about it. And I thought, well, that's what I want to do in my career, and was really kind of planted the seed in my brain that if I'm going to be the best at what I can be as a restorative dentist, I want to be able to get to the level to where I could stand in a room of my peers and educate people, and to be able to provide something positive. And that's exactly the kind of the catapult that I had when I got out of dental school. And thank goodness that I took the time to go to these CE courses, because I think, if I hadn't, it may have taken me 2 or 3 years to kind of really figure out that I needed to heavily invest in education.
Sure. I mean, to even have that foresight to know that this is something you want to do in your career is quite remarkable at a young age. But you're living that. I mean, you're truly one of the most remarkable and brilliant minds in the dental education platform. And
Well, thanks.
I mean, I've taken probably 2,100 hours now, and I think 100 of them have been with you, and truly the most impactful 100 hours out of anything I've done.
Oh, well,
So it's
thanks.
just something that I can't even begin to emphasize the impact you've had on my career, but also the thing about the Dawson Academy I really enjoyed was the cohort. And with that cohort, you have 20 some people in that class with each other. And I was able to witness this whole thing where we just started learning about photography and the basics of an examination. And through the course of a year and a half, you changed all of us. And it was something that it just became a very complex unit of dentistry that was happening amongst all of us. And I was just very proud to see that you're living this whole vision that you had for yourself at such a young age in your career. And what a remarkable thing to do. So bravo to that. And
Well,
I think it's something cool that Dawson Academy offers.
well, I'll tell you what. It's I've been teaching with the Dawson Academy now for going on 10 years, and it's such a wonderful opportunity. I'm always humbled in the fact that I have this opportunity. And one of the most gratifying things that I see is just what you're talking about, is see the evolution of dentists as they come through this curriculum. So, our core curriculum is 7 courses, and each of these courses is 3 days long. And because you know how when we start off these hands-on, when we get back together, is everybody kind of shares what's been going on
Mm-hmm.
in their life and their clinical journey. And it's just amazing to witness the metamorphosis of confidence and communication skills and growth and the trajectory that people take, when it's really kind of focused, when you're learning clinical skills that are so valuable for a patient's long-term health, and the satisfaction that we get as being physicians of the mascatory system, like Dr. Dawson always used to say, the satisfaction that we get by being able to provide that to patients. And all this gets just kind of balled up together, and it's just an amazing trajectory. And to see what you've done with it, Kevin, and there's been so many people over the years that their career is just completely revolutionized, and they're working less, making more, happier in dentistry. And that's what we all want, is we want to have our dentistry be predictable, we want it to be profitable, and we want our dental practice to lead us into a happy and a fulfilled experience, and not get ourselves kind of caught up to where our dental practice is running our life.
For sure. I think it's so profound. And one of the things we talked about at one of the first sessions was a lot of people take dental education. It's just very few actually take action upon the education that they learn. And is there, from your vantage point, is there a specific quality that you would tell some of these young dentists out there to maybe inspire them to take the action, or there are certain qualities that you see within students that are different, and those students end up doing more in terms of implementation?
Yeah, well, everybody reaches a point in time in their life and their career where change is going to be important. And one of the most important things I like to tell younger dentists is you need to figure out how you want your life to look. A lot of dentists just kind of get into it. Maybe they're an associate, and then after 4 years, they're fed up, and now I'm ready to own my own practice. And you're just trying to work in your practice, and what happens is, like, your work-life balance really just gets off, because you haven't really had any intention about how you wanted your practice to be and how you wanted your personal life to be with your family and your loved ones, and what's important to you outside of dentistry. And so, I always like to recommend people is to have a very clear vision of what it is that you want for your life and how you want your practice to support your life, and build your practice around supporting what it is that you want, and not the other way around. So for instance, if you say, gosh, I really want to work 4 days a week. Well, if you don't want to work 4 days a week, then start working 4 days a week and build the growth of your practice and how you schedule and how your treatment plan, build that around a 4 day a week schedule. Don't start working 5 days a week and think, well, as soon as I get to the point where I can work 4 days a week, I'm going to switch it. Because what's going to happen is you're going to create a monster that has
Sure.
momentum, and now you're going to be trying to change the momentum of what you've created to now try to fit it into your life. So start with that clear intention, right from the get-go.
Yeah, it's so profound. We've had so many people to reach out from the last couple shows, and they've all brought that up, is that they work in these associateships and they're struggling to figure out even time or have the capacity to figure out what they want to do with their life. So having a vision is so important, and that's something that we've said through emails or phone calls. And I'm sure, Jim, I want to kind of include you on this too, because you've changed everything with your practice over the course of many years, I'm sure too, and you've taken Pankey and Dawson and whatnot. And I would love to hear your aspect of things.
No, absolutely. Leonard, you're spot on. If for the first 5 years of my practice, I was climbing the ladder of success, and as the old adage goes, I realized I was had the ladder leaning on the wrong wall, and so, and I thought I just wanted to be bigger and faster and more volume, and and all those kind of ridiculous notions that had very little to do with who I was and what my creative ability was and what my life really needed to look like. And then I thought I knew everything until I met Dr. Dawson in 1988, and then I realized I was the dumbest guy on the planet. So start from there, and he was so influential. He was the first real mentor I had that helped me to really look at focusing on what it was I wanted for my life, how I wanted to be remembered, how I wanted to fit into this world and leave it behind and look that far forward and then build it from there. It's absolutely critical. I mean, if you don't know where you're going, anywhere will take you there, right? So,
Sure.
And it's very important to remember, and one of the things I haven't been all that great at is people who are passionate about dentistry can really become immensely consumed with it, and so you've got to really know. I would recommend people know how to temper that as well. Mentorship is so important, and it was so nice about what you said about Leonard, because growing up, growing in my growth in dentistry, it was all about the mentorship. It was all about Dr. Dawson, Dr. Spear, Henry Grimion, Parker Mayhem, these people who Jim Kincaid might be giving the plan. People saw something in you didn't see in yourself, and would help you develop. And that's so critical. And those are the people who help you shape that vision for the future. So it's nice to see you guys have that relationship and what it means to you. It's awesome.
Yeah, let's talk about mentorship. I think that's an important topic that is always brought up amongst every guest and every speaker that has come on ACT over the course of COVID. And I don't know, Lenny, I know you've had many mentors that led your way, and obviously Jim, you just mentioned that too. So it's something that I do believe that we're standing on the shoulders of the giants before us, right? That whole adage there, and I think it's something I would love to hear, Lenny, how you sought out people as mentors and what you did to keep them, and what you do now in your place to find mentees and how that ends up working out.
Yeah, well, it's interesting. So, my first main mentor was John Cranham. And so when I graduated from dental school, and I told you that I really needed to seek out really high-level education right away, I started taking an aesthetic continuum that was in Charlotte. And Dr. Cranham was kind of one of the junior instructors at that time. And, he was probably just 12 or 13 years out of school and was really starting to kind of take off. He was really kind of a nobody at that time. And so I was at this, and I was always kind of a probably a little bit overconfident when I was younger. And so I went up to the head instructor and I said, hey, if you were young again, what would you do? And he says, well, you really need a mentor. And I was thinking, it's like, wow, this guy's going to be my mentor. And he said, so why don't you go ask that guy over there? And he pointed to Dr. Cranham. And so, I went over there and kind of like my shoulders were low and I was kind of depressed for a few seconds. And I stumbled over to Dr. Cranham and I said, hey, this guy over here said you're supposed to be my mentor. And he was like, oh, wow, that's cool. I'd be happy to be your mentor. Because I'm not sure how many people had asked him yet, so he didn't know what he was signing up for at the time. And, and he's been trying to get rid of me ever since. So he's been trying to get rid of me for about 20 years. And but, he was so influential in my growth and my development. And, John's speaking style really resonated with me. And, as I developed my own style, I was certainly heavily influenced by him. And, and he was, most importantly, he was there to give me a kick in the butt if I needed it. And, I tell people, I said, look, there's been a lot of times that, my mentor has dressed me down, and when I've gotten ahead of myself or I expected too much or I thought I deserved more than I had earned at that point in time in my life. And, mentors can be, in dentistry, what Dr. Cranham was and what Dr. Dawson became for me is they were great mentors, not only in dentistry, but also in life and how to deal in relationships with other people, how to be a mentor as far as our families go, raising our children, all these things. And, those two guys became so, important in my life that, in many ways, they're really big father figures to me as well, and have helped to really kind of guide and mold me into a man as I was growing. Because, when I graduated from dental school when I was 25, and, we all know at this point in time, 25-year-olds, we look at them now, they're babies, they're so young.
Look at Kevin.
Yeah,
I'm 33.
You just look 16, right?
I know. I get that my whole life.
But we all need the moral of the story here is that we all really need mentors. We need people to really help and guide us. And one of the things I always tell people is like, don't be afraid to ask for help. I think one of the biggest mistakes we make is that we assume. One of the worst things that we can ever do is assume, right? Because typically we're wrong when we make assumptions and assume that we're going to overstep our bounds or assume that people aren't going to be willing to give their time. And, so everything's going to happen when it's supposed to. And I'll be honest, I mean, I have a lot of dentists that come through the academy now that ask me to mentor them. And unfortunately, I have to, a lot of times, just tell them no, that I can't. And I refer them to somebody else that maybe has more time to do that, because there's only so many people, at a time that you can give them your time, because there's, look, I mean, there's only so much energy that you have for yourself, for your family, for your practice. And then when you start helping other people, well, then you're giving away a part of you. And there's certainly only so much of that you can give to other people before you start to deplete yourself in an unhealthy way. And then sometimes you're looking in your gas tank and you think, gosh, I have nothing left for myself.
No, that's very profound. I think we talk about the balance of life a lot, and knowing that to take on something, you have to then take something away, right? So we get asked this a lot, though, with mentorship, like, where can you find mentors and how do you keep them? I don't know if you have any recommendations or any thoughts about that.
I don't know, Jim, do you have anything to say about that, on that?
So, sometimes what you said a little earlier, Leonard, was so profound. Sometimes that people around you that you respect can become mentors. It doesn't have to be someone who's an accomplished national speaker, an accomplished teacher. It's often someone in your community that has the same philosophy, has a similar philosophy, and like what you said about assuming, an assumption is our own narrative that we've made up. It's our own. It's a narrative we made up on some beliefs that we have that may or may not most often be true. And so you can't assume that somebody doesn't want you to ask them or wouldn't help you or you inconvenience them. And so you just have to ask. And some of my closest mentors have become also my closest friends. And even like with Bill Robbins and I partnering now, Bill's a great mentor of mine. And we've become close friends. But we were friends before we even mentored each other, really, and we worked together so well, even though we're very different people. And so you just have to. I think it's important to, number one, expand your sphere of learning. Seek out those places like Dawson Academy, Tank Institute, Career Education, Voice Center. These places where people gather together that are like-minded, and those are the places to look. Even this platform, Kirk Barrett is one of my favorite mentors. And Kinsey's becoming one of mine too now. When you find like-minded people, you have to ask. And sometimes, as you say, someone may say, I'm sorry, it's not possible for me to mentor you at this level. However, maybe we could get together once a month, or maybe we could just check in once a quarter, or maybe you could just send me something to show me what you're doing, and I could help you work on that piece of it. But you have to make yourself available. I mean, I thought Dr. Dawson was going to put a restraining order on me for a while, and he did, but I'm not supposed to talk about it. But I really, you make yourself available. When you get dealt a good hand like that, when you meet someone like that, you have to take advantage of it. And most dentists who are accomplished are very complimented by the ask. Like you said, Leonard, and you, Kevin, that when somebody asks you for help, it's a very sincere compliment, and you're willing to extend yourself to the greatest extent possible. They're all around you. You just have to really, everyone you need to know, really, if you think about it in a different way and ask. Yeah.
It's true. I think vulnerability is a big thing, and just admitting you don't know anything, and just trying to be a sponge and say, just, dang, I really respect who you are. How can I become you? And I think the best thing whenever you're looking for a mentor is to someone say, I see myself in you. If they say those words, it says, okay, I've kind of got some interest in this person, and now what do I do to keep this mentor? And that's something that, I don't know, Lenny, you're not going to get rid of me because you said those words to me in Napa, and I've never forgot that. So you said, sign up for Dawson, sign up for the cohort. And I said, okay, how quickly can I get this done? And let's do it. So,
well, one of the things, Kevin, I love what you said was talking about vulnerability, because that's what's so essential in a true mentor, is that somebody is willing to, share their struggles, be honest about how they've overcome things. Don't gloss over your struggles in the past to try to just present that everything is perfect in your life, or only share your successes, because anybody who, nobody's being fooled by that. And it's even more important now in our society because, in dentistry now, there's so much of, what I call dental shaming that's occurring in the industry, to where people just want to post things to make, in the hopes that they're going to somehow make somebody feel bad about their life, and somehow they're going to feel better about their life, thinking that somebody's going to feel maybe worse. And there's a lot of that occurs today in dentistry, and it breaks my heart, because it really doesn't serve anybody. It's not serving the person that's trying to build up their egos temporarily, and it's certainly not helping the people out there that are thinking, gosh, why isn't my practice like this, or why don't I have those cases, or why isn't this or that? I mean, it's vulnerability is just, if as human beings, if we could all be more honest with each other, we'd be so much better off.
I love that.
In every aspect of our life.
Absolutely.
We've had a lot of that said on this platform. Is we've had some of these people come out and say, I was a horrible dental student, and I wasn't the smartest guy in the room, and academically I'm not the greatest, but at the same point in time, I've moved further ahead because I fail. I admit my failures, and I learn from the people around me and the mentors that have shown me the way. And I think that's just such a profound thing, because everybody struggles. Everybody has those moments of those patients that don't go the way they should, and they tried their hardest, and it just didn't work out. But those are the best learning lessons, as opposed to what we think is the perfect case or perfect patient. So I've learned that from you, Lenny. I've learned that from you, Jim, in terms of just what you guys have taught in this, last couple of years. And it's just something that I think it's important to we all recognize those and share them, because if you're going to be able to get out and talk about them, we can all as a community become better as well.
Right.
So, Lenny, I want to talk about your practice. You mentioned this a lot in dentistry, or Dawson, when we were out there. So you went from Chicago over to Charlotte and started up a practice. Or bought a practice. I forget which one.
Yeah. So I bought a practice. So when I graduated, back in 1999, I graduated with about $240,000 of student loan debt, which is not that much today by today's standards.
That was a lot at the time.
20 some years ago, it was a lot of money, and
sure.
It still is a lot of money, but it was a heck of a lot of money back then. And there's no way that I could afford to be an associate and pay my student loan debt and actually have a life. And so I recognized probably around midway of my junior year of dental school is that I'm going to just do this. I'm going to buy a practice right out, and I'm going to dive in, and either I'm going to live or die, and I'm going to figure out which is going to happen. And so growing up in the Midwest, I grew up in Ohio and Indiana, and when I graduated from Northwestern, and after experiencing 4 winters in Chicago, I was absolutely going to leave the Midwest. And so I just kind of picked North Carolina. I kind of went down to Charlotte a few times, checked it out, like one weekend, put 1,200 miles on a rental car, just going all over. And I said, you know what? This is the right place at the right time. I started looking for practices to buy, and I found one. And I found one that was in Union County, North Carolina, which is just adjacent to Mecklenburg, which is where Charlotte is. And, and I did that on purpose because at that time, there was, I think, about 790 dentists in Charlotte. And I thought, well, I could go into Charlotte and become one of 790, or I can go 22 miles out in this county. And at that time, there was, I think, 12 dentists. And I thought, well, I really like those odds. And so I found a practice. It was a neglected practice. It was antiquated. It had dental chairs that were already 30 years old. There was, the most modern piece of dental equipment in the practice, I think, was the light switch when you turn the lights on. And, it wasn't a good situation, but it was something to start with. Sure. And the most important thing that I had was a patient base of really great people that were looking for somebody to come in and give them the time and the attention that they really were wanting. And, one of the biggest things that I learned as a young dentist, walking into my own private practice, was that I learned that we're in the people business. And if you can't communicate with people, if you can't talk to them and help to lead them and educate them and build a trust with your patient base, it doesn't matter what your equipment looks like. It doesn't matter what kind of office you have. It doesn't matter what kind of car you drive. People are not going to bless you with their trust if you aren't capable of forming that relationship with them. And, so, even I was practicing in this very antiquated practice, but I started to do a lot of very amazing dentistry. And it just really taught me the value of that. And so, one of the things I always like to tell young dentists is that, don't always get yourself into the habit of like, I'll be happy when syndrome. It's like, well, I'll be happy.
Sure.
I'll be happy when my student loans are paid off. I'll be happy when I can finally buy the house I want. I'll be happy when I can buy my first nice car. I'll be happy this. I'll be happy when. And if you think that way, you're never going to be happy, because there's always going to be something else that you're looking for. And I think the key to happiness in being a young dentist is finding the joy and the satisfaction, the happiness and the contentment of where you are at that moment, because all of us are in the right place at the right time. And if we can just appreciate the here and the now, stop living in the past, stop trying to live in the future, and enjoy the present. And when you do that, your attention is going to be focused in the right place, and the explosion that you'll encounter in your practice can be remarkable.
That's a bold statement. I mean, I wish I could just like print that out for everybody to read one more time, because if You don't need the fancy equipment. You don't need the fancy cars. You don't need the new house, whatever it may be. But if you're living in the present and enjoying what you're doing, I mean, there's nothing better than that, right? So I think we all get caught up in terms of what everyone else is doing, especially with social media. I think social media is a great thing because you can connect, you can learn, you can do that, but you also compare. And I think the comparative element is dangerous. So I think if you're really trying to hone in on what everyone else is doing as opposed to figure out what makes you happy, not what will make you happy, I think that's important. So, I mean, bravo to that. And that's some profound words.
Yeah, and being happy right now, and understanding maybe you're struggling, is find happiness in the struggle.
Correct.
Enjoy the battle, enjoy it, because it's going to happen really quickly. I mean, the things that you are struggling with right now that seem sometimes that you can't overcome them. 5 years from now, you're going to look back and you're going to smile when you think about those times. And if you can smile when you think about them now, it's even better. And
Sure.
as young dentists, a lot of us, we feel a lot of financial pressure, and I get it because I've been there. I've been completely broke. I've had a net worth of minus more than $1 million. When I started buying a
Yep.
practice and a house and everything else. I mean, I know what it feels like to be suffocated in debt, and then think, gosh, my practice isn't anywhere clear to what it is that I want. But something that's so important for young people to realize is that, if you chase money, you're always going to be chasing it. What do we
Sure.
want to do is we want to put ourselves into a position where money chases us, right? To where it's running us down. And then the question is, well, how do we get money to chase us? Well, there's a couple things that we can do. Well, number one is we can understand that money comes from providing value. And when we provide value in an ethical way, people respond to that. And they
Sure.
respond to it in an overwhelming way. When I graduated dental school and I bought this practice, I looked like I was 12 years old.
You know how
And,
that goes.
and yes, yeah. And somehow,
Like you look like Kevin. Yeah.
Yeah.
somehow these, patients put this immense amount of trust into me, and it was great. But not only that, what's really important for a lot of young dentists to realize is that the most successful people in the world are the people that can solve the biggest problems, right? Well, why is Elon Musk a billionaire? Well, he solved a couple problems. He
Sure.
made an electric car that people wanted to buy. He figured out an affordable way to put things into space to where the rockets could be reused. He solved really big problems that the world needed, and he's been rewarded for that. What did Jeff Bezos do? He solved the problem of giving instant gratification for any single thing in the world that you want. You can get it really quick. Well, if you want money to chase you as being a dentist, what do you need to be able to do? You need to be able to have the clinical skills and the communicative knowledge, the ability to communicate, to be able to help people that have complicated problems. And when you can start to solve these, when you can take people out of pain, when you can do things for patients that no other dentist has done for them, these people go back out in the community and they're going to sing your praises, and your practice is going to grow so quick. But you've got to be able to have a way to differentiate yourself. And the way that you're going to be able to do that is to educate yourself to where you can solve these bigger problems for people.
Absolutely. I want to get on that topic big time. So before you even started doing the education though, and you were trying to develop trust in a relationship with patients, was there anything that you would recommend to some young dentist of how to get that trust from the get-go?
Well, I think the most important thing is to be honest, and to, I always talk about what I call the 3 C's, and it's concern, compassion, and care.
Sure.
And, one of the things that dentists, especially as we get older, is that we start to be concerned less and have less compassion. And most of our patients out there that end up needing extensive dentistry are people that have been just, kind of neglected by the system of standardized care that's been developed in the industry, which has been molded by the insurance industry.
Mm-hmm.
And a lot of patients, the assumption for so many dentists, and this is one of the comments that we get all the time when students are coming through the Dawson Academy, is they think, well, geez, I just don't have these patients, or I have an insurance-based practice. There's no way that I can do this in my practice. And the difference is that what I'm taking the time to do is to express concern
Sure.
and what is going to happen to these patients in the long run, so that way I can start to educate them about what their choices are, because everybody wants a choice. And if you don't give people a choice, then how are they going to choose? If they've never had the ability to choose to take care of themselves at a high level, because you go in there and you have the attitude that the patient's only going to do what the patient, what insurance pays for. So why am I going to waste my time trying to talk to a patient? Well, that's negative energy. And
Right.
the way people respond to negative energy is they become repulsed by your energy and they move away from you. And they don't trust you to do those more complicated things in there. So, and then when you start to express concern for a lot of patients, then it's time to become compassionate, because so many times what we're going to do is we're going to overwhelm our patients with the choices that they now have. And they may be overwhelmed by fear. They may be overwhelmed by the expense. They may be overwhelmed by other things that are going on in their life. And now it's time for us just to be compassionate and allow them to do it when it's the right time for them, and support them, and not present a treatment plan to a patient. And when they say no, then our feelings are hurt and we think, well, this patient doesn't like me anymore.
Sure.
So now when they come in for hygiene next time, I'm going to give them the 45-second hygiene check, and I'm going to act like a scorned lover because I've been rejected.
Sure.
And that never works. But if you express concern and you really let them know what's happening, give them choices, and you give them compassion, it's amazing how the patients are going to come back to you for the third C, which is the ability to provide the care.
Awesome. No, those are great words, and I think it's something that I find you need the time to do that, right? I think that's the problem, is when you first get out of school, you're so concerned with getting through everything so quickly that you forget that you are relating to people. And when you
Right.
can actually slow things down, you end up doing the three C's. You end up treating and I don't know, caring for people like they should. And likewise, you become far more productive. You treat people in such a manner that you allow them to have the optimal care that they deserve. And you become far more fulfilled because you're not putting out fires all the time either, which I think is important. So I don't know
Yeah.
if you
Well,
want to get on that topic of that.
yeah. Well, our job is to always allow a patient to choose to do what's best for themselves. And then after they make that choice, then our job is to support them in whatever they decide to do.
Sure.
Right? But if we don't give them all the possible choices, then we're really acting in an unethical manner, because now we're boxing them into a decision that is being made by us or our influence.
Hmm.
Instead of our job is to educate. Our job is not to tell people what to do. Our
So
job
true.
is to give them those options, and then once we give them the options, if they choose not to do care that they need, then that responsibility now falls to the patient. Because you've heard me say before, Kevin, that I'm really big on making sure that patients own their own problems,
Correct.
right? And so don't pass the burden of responsibility of your condition onto me because I'm a dentist, or because you chose something different 5 or 10 years earlier that's led you to a decision, you made a decision that's led you to a point to where now you're frustrated, now you want to blame somebody,
Hmm.
right? So as long as we diagnose and give patients options to choose, then we're going to allow them to own their problems.
That's great. Jim, do you have any thoughts on any of this, communication wise with patients?
Yeah. How long you got? So yeah, I mean, we could talk for hours, but I think Leonard, you're exactly right. Mary Autumn used to say, and I don't know, this was a quote that she had, she made up, but she said, every person carries their own best physician inside of them, and
Sure.
our job is to help them discover that. And it's exactly like you said, Leonard. Our job is to help communicate in ways to help people understand where they are at this moment, clarify what their intention is for a preferred future, and see if we can help connect the dots to help them get there in whatever time, money and life circumstances they have that dictate that. And you're right. And going back to what you said, Kevin, the problem that I see, and having facilitated, hundreds of courses throughout, Pankey Institute and Spear and the visiting faculty, is that we take the information, dentists take the information, they take it back to their practice, but they fail to make the changes necessary to carve out those pieces of time to help move the needle. You can't do it all at once, but you could block out an hour, twice a week for a comprehensive evaluation, or you could block out that time just to get, to have a conversation about someone to help clarify, what's important to them and help identify the things that you see that maybe they didn't ask you about. And I always use that acknowledgement. So, hey, Mrs. Brown, you didn't ask me about this, but I think it's important for me to tell you what I see. And then you can tell me if it's important to you or not. And that gives them, again, another choice. So you're not just vomiting a bunch of information all over them, but you're opening their eyes to something that may be possibilities for them. And you have to do that incrementally. And it goes back to mentorship. And so Bill and I are talking about now in terms of our platform too, is how do we help people make those incremental changes, especially when you've got a practice that's swallowing you whole, and then you've got to get out somehow and start to make change. Yeah, all those points you made are so important. Our job is to help. One question you can always ask your patients too is, do you want me to fix your teeth, or would you like for me to help you become healthier?
Sure.
And if you ask that question, it reframes things in people's minds, because in the insurance-driven, commodity-based, unit fee dentistry model, people are thinking about things as a commodity. Well, when you shift the focus to their health, now it's a different conversation. Now you can introduce those things like joint health, airway, function, optimal function, lifelong stability that they've never been open to before.
Sure. I think it starts from dental school, though. And unfortunately, when I was at Michigan, whenever we'd see a new patient, the student would grab me and we go right up the x-rays right away, and we start diagnosing interproximal caries here, 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 here. We don't discuss what the signs and symptoms of instability these people have. A case in point was today. A new patient came in and I spent an hour with them right in the beginning. And the first thing she said is, I don't understand why you would do this. It doesn't make any sense. You're a busy guy. I don't see how you could be productive with this. So, she had decay on 2 and 4, and that would have been a 2 MO, 4 MO. But then when you start looking at things and start doing the muscle palpations and we start discovering things, the case ended up becoming something where I said, I'm seeing some signs of instability here. You have a couple minutes, I'll give you a quick splint, and I just kind of did this and put that in there. And for 7 minutes, she had it in there. I came back and she's like, I feel like amazing difference. What can I do to make this better? So 7 minutes right there made the world of a difference. And eventually it's going to end up to doing some complete care. We'll probably end up doing some Invisalign on her. We'll do some equilibration. We might do some restorative work. Tell me that's not more productive than 2 MO and 4 MO, which we will do. But
depends how much you charge for the composites.
Sure.
If you charge like 2,300 composites,
yeah, exactly right. So, but I'm still going to end up doing the fillings, but it's not about the fillings, right? So we start looking at all these things, and I think that's unfortunately in dental school you're ingrained in just find decay, see decay, fix tooth, repeat. And a lot of these new grads get out and they're put in these offices that are also the same way, where it's a factory where you're just running in and out. So I guess that would be my challenge to people, is just to take the time and devote to just one patient a little bit more time and see what you could do. You may not know all the answers, but at the same point in time, you can kind of lead a direction that you can do the 3 C's like Lenny talks about, and eventually start changing the way you practice slowly and surely. So,
and think about too, in the context of what kind of mindset that type of practice puts you in, the fix and repair practice. And so oftentimes and Lenny, you've probably had this kind of conversation too, when you look at a set of casts or you look at some photography and you ask the students, what do you see? And then they may see, I said, what would you diagnose? And they say, well, I diagnose a crown. A crown's not a diagnosis. A crown is a treatment.
Sure.
You're mistaking diagnosis for treatment, and the problem is that most dentists don't know how to make an adequate diagnosis, and they don't
Sure.
go through the process to be able to do that, and we don't even have we don't take the time or have the wherewithal or the knowledge base to formulate that in our own head. So how could we possibly deliver that to patients? And so that's the beauty of lifelong learning and having a passion for comprehensive care and interdisciplinary care and restorative care and optimal care. Because that's when you can offer your best stuff. But you can't offer your best stuff if you don't know what it is. You don't know how to diagnose it really. So that's the process I see that's so critical. The awareness is so critical. I advise every young dentist to think about.
And the importance of going to something like the Dawson Academy or Pankey, Spirit, whatever it is, find those educational routes. And I know it's expensive. We've all been there, right? And they're pricey, but I can challenge every single one of you not to make it up within a year, because I did. And I wasn't doing this type of dentistry prior. So if you can at least, and I'm not saying I'm doing full mouth reconstructions every day, but you can do equilibrations, you could do Invisalign, you could do these, and eventually it kind of builds, and it's just kind of that exponential growth that will take place going long term too, which is important. So I don't know.
It really is. Well, one of the other things that we can talk about, and maybe we can do another show one time with us again in a few months, but learning clinical skills is one thing, but then what are the other aspects that have to be addressed, in other words, to still be successful? And what are the internal challenges that the dentist might have within themselves that's holding them back, right? Because we all know hundreds. I mean, I personally know hundreds, maybe thousands of dentists who have spent thousands of dollars, tens of thousands of dollars, hundreds of thousands of dollars, and thousands of hours of CE, and their practice hasn't changed one bit. And then the question has to become, what is keeping them from being able to change? And it's not that they're lacking clinical knowledge. Right. It's something much deeper than that. But that would be, we need whole another hour or two for that.
Oh, that's great. That's really great.
Maybe
I think
maybe a week.
Yeah. I think that's so important to kind of do a lot of self-discovery with that. And I think you do figure out a lot of that stuff in time when you start really reflecting on that. But I think another thing I found productive was the fact that every single time Lenny taught me something, I came back to my office and I taught it to my team. We spent a Tuesday afternoon meeting, and I said, listen, the most common thing we see in dentistry is not caries, it's not periodontal disease, it's occlusal disease. And we look around the room, and 8 out of 10 of us probably has some dysfunction. So if 8 out of 10 of us dental professionals have something going on, what is our patient base doing? So from there, it really inspired my team to really kind of get behind this model. And so we started teaching bimanual manipulation. We started taking photographs. And once we started really having them commit to it, it was a lot easier for the whole philosophy to change shape within our office too. So that was probably my pearl that I would offer is teach your team first.
But they committed to it because you were committed to it, right? And then again, it's, are you willing to put yourself out there? Are you willing to be vulnerable? Are you willing to take imperfect action, to move forward in some way? You've got to have a lot of ambiguity tolerance, and you can't have a lot of fear of failure, because if that gets in your way, that's what gets you stuck. If I don't learn to do it perfectly, and Lenny, you probably know this, going through workshops, where you're teaching someone how to adjust a bite swing, they go, well, should I adjust this or this? I said, I don't know, just go ahead and do it. It's just a piece of nobody's going to die. Just try it and see what you work. And they have to have exactly the right answer and exactly the 10 steps before they'll take the first one. No, just do it. Just jump in and do it. Just do no harm. But
absolutely,
that perfectionism will kill you, and that's what you have to get over. And what you said earlier, too, stop worrying about what's coming down the pike and stop worrying about what's behind you, because it's already done. Just take that. You be your best that you can be today. And excellence is about being just a little bit better tomorrow. It's not being perfect. It's just being a little better tomorrow.
The world is full of people who have sacrificed the future for the past, right?
Exactly.
Sure. Yeah. Some deep words there too. Made me think. It's always make me think. I don't know. This is I hope people are paying attention to this because there's some profound words here between the two of you and what you're saying. And I've learned a lot. It's something that I think is important that we just all kind of keep moving forward and taking action, but also understand that there's a better way to do things than just, I don't know, I'm biased, but be in that PPO run of the mill office that you're not going to be able to do this type of work. And Lenny, you did talk about that one diagram, right? The stress diagram.
Right.
I don't know if you can do that like online, but I always felt like that was such an impactful thing.
Well, so it was a diagram. I think I had. Let me find. I think I got it on my phone here. I can pull it up here. Um, where yeah. So the diagram was called the failure to diagnose, and and it was basically a flow chart that was based on when we're talking about at the DOS Academy, that particular course. We were talking about missing the biggest thing, which is people that are suffering from functional deficits and not necessarily bacteria. And what we all know is that most of our patients, their biggest problems with retaining their dentition isn't from bacteria for the most part. Most of our patients these days, it's wear and function. And we're talking about how, if we can't recognize these signs of instability and these problems stay silent, which means that they aren't really causing the patient any perceptible issues because they've adapted to the fact that they're living in discomfort, right? So somebody who has chronic headaches from poor occlusion, if they don't know what it's like to be comfortable, then they don't know how miserable they are until they're taken out of their misery. And so when we have our patients that have these silent problems and we do treatment on them, and all of a sudden, maybe we're going to just do a couple of crowns on them, and all of a sudden we've changed their occlusion, and now they're going to have trouble adapting to what it is that we did to them. And then we're struggling because now the dentist, the patient is blaming us. So the dentist, us, we're owning this problem. And when we get into situations like that, what does it lead? It leads into stress, and then stress creates fear. And then we're afraid to do certain types of treatment because it didn't work out. And then it's the same thing when we're just kind of going haphazardly about that, is that people have trouble adapting, they blame the dentist, that leads to stress leads to fear, and when we become fearful, we become paralyzed, and a lot of times most dentists, we retreat to a comfortable spot, okay, these are the procedures that I'm comfortable doing. I don't like doing 8-unit cases because I did it one time and it was a disaster, and I swear I would never do it again, because not only did I lose money, I lost a ton of money when it was all said and done, and the patient never came back, and it was just a horrible, fearful event for me. And all of these problems really kind of stem from the failure to diagnose, because if a patient, if they're wearing their teeth, or they're breaking their teeth, or they're having mobility of their teeth, or they're having joint problems or occlusal muscular headaches, if we don't actually diagnose and then treat the cause that's causing instability, then whatever we do is just going to lead to the same problem again. That what are they going to do? They're going to break our dentistry, and then that becomes a problem for us.
Or worse, yeah, it's going to lead to the same problem or worse, right? So you get this question too, Lenny, a lot when you're teaching someone how to use a face coat, how to mount a case, how to work through looking at photography, looking at imaging, and how do you put this all together? And the question I get is, well, do you just do this on your big cases or what? I go, well, what's a big case? Because if you cut a terminal molar and you have not done a thorough exam, and you cut a couple of crowns, and now you've totally tipped their occlusion off the cliff, that's a big case.
Sure. It is.
It's not about the number of units you're doing, it's what you're doing. So every case is a big case, potentially. You just want it to be a big case in the way that you hope it's supposed to go, not the opposite direction. And trust me, how do I know this? Because I've done it. And
that's when centric relation becomes the eighth wonder of the world at that point, right?
It's painful, but you learn from it. You go, okay, I screwed that up. Let's try not to do it again. Yeah. Right. Did we lose Lenny?
I think we might have. I don't
Lenny,
know.
are you there?
I don't see him. But no, I think that's so profound, and ask me how I know is something that you have to go through those struggles in order to remember that. But again, you embrace that though. That's something that you take
There.
on and know that there it is back. Um, it is actually a privilege to say that I've been through that. Ask me how I know is something of experience, and it's something that fortunately that those are hard memories that you have to reflect back on. But at the same point in time, you're not going to make that mistake again. Hopefully,
Failure is an option. Failure
sure,
is an option, and it's an option for learning what it is. I've learned my
sure,
most profound lessons I've learned in life and in dentistry have been in the hardest struggles that I've had. This is a learning experience that we're in right now, dealing with all of the COVID crisis and the challenges it places on us. But there are plenty of these challenges along the way, from things we do by omission and commission. And if we're willing to just be with that and be better because of it, the future is good.
absolutely. So, well, we have 1 more minute, so I want to kind of wrap up here. I don't know if you guys have any final words for if you were a young dentist or you're advising somebody, what would you recommend to them as they begin their career going forward?
Well, the biggest thing is just to lead your practice and your life with intention. Is make sure you have a very clear direction that you want to go in. Now, it doesn't mean that you can't change directions at some point in time, but I see a lot of young dentists who are wandering, and they're wandering aimlessly, and they get really frustrated after a few years because it's not turning out how they thought it was going to be. And so my challenge, if you're experiencing that, is just to sit down and start to think about, where are the areas of my life where I need to have more intention. And once you set those intentions, is move that to them in a fruitful fashion, and don't be afraid to pivot and change your intentions once you learn something.
Yeah. Yeah.
Very wise.
Yeah. And then once you find that, be courageous and be resilient. Nothing happens without those two most important characteristics you can have. Resiliency matters so much. And get up off the mat and do it. And put one foot in front of the other and move forward. And with that intention, you'll find the happiness you seek.
And lean on the people that you rely upon, and just be vulnerable towards them. And that's something I'm so grateful to have Lenny on here. It's just our friendship continues to keep growing, and it's something that started 2 years ago, and it's something that I'm really grateful for. And I'm a different man because of you. I'm a different dentist because of you, and it's something I'm very appreciative of that. So it's just a ton of gratitude sending your way. And Jim, I've gotten to know you over the last couple of weeks,
Thanks.
but I appreciate all that too. But I can't be more grateful you coming on. I look forward to a couple months from now when we have that discussion again about changing internally. I think that'd be a very profound thing too. So,
Let's do it. Yeah, definitely.
Cool.
Hey, I'm so glad Bill was out of town and I could
I know my unspoken co-host Bill Robbins, but it's something that this has been a great conversation. I think we've gotten very far with a lot of topics, and I'm appreciative of that. Lenny, I don't know if anyone wants to reach out to you at the Dawson Academy, but I think it would be something that I would sign up and do it right away. It's not, but that's my nature of things, just to do. But
well, that's because you have intention.
I do. So, and good mentorship. So, how could you be reached if someone wants to reach you, if that's something that they're interested in?
Yeah, for sure. People can reach out to the Dawson Academy. Feel free to reach me on my personal email address, which is it's old school. It's Lenny Hess, LENNYHESS at AOL.com. And if I can help you, let me know.
Cool. So I appreciate it, guys. I guess we'll hang up now because it's 9:02, but thanks for copping on, and very, very fortunate both of you here. So
hey, thanks so much.
Awesome.
Thanks, Kevin.
I had a blast. Thanks, Kevin.
No, this is great. Thank you very much.
Yeah,
all right, we'll talk soon.